Welcome to another episode of the Talent Transformation Podcast. Today we have Carol McDaniel, Vice President of Talent Acquisition at Providence Health. Carol has over 20 years of experience in the area of talent acquisition, talent management, and HR in general, I suppose. And I'm really excited to have you here. Thank you so much for coming.
Oh, thank you so much. I'm really excited to be here.
Wonderful. Great. So you've been in the industry for a while. And tell me about that. You mentioned to me before we started that you were a recruiter at heart. So let's just go right to that, because I was a recruiter too.
Oh, excellent.
Yeah.
There's a special breed of people
They
that
are.
are recruiters, and they're either really spectacular or kind of creepy.
Yeah.
Yeah.
Yes.
So I'd like to think I'm more on the spectacular side than the creepy side.
I'd like to
So,
think that too. But,
same. So,
I might not be that self-aware. I don't know.
well, what's interesting about recruiting in general and talent acquisition as a whole as an industry, you don't ever really go to college, go to school and say, I'm going to get into talent acquisition. I'm going to be a recruiter. 99% of the people you talk to just kind of fell into it. And I would tell you, I follow the same suit. I was in the military. I was in the Air Force for 10 years. And post leaving the military, I found myself just, again, like a lot of veterans, I don't know what my skills translate to. I don't know what to do. And I thought I had a really successful career in the military. And then you leave and you're like, who am I?
Right.
By happenstance, I had a friend who referred me to a staffing agency and said she's probably can be good about helping people find jobs. So let's put her in this. Back in the day, I won't name the company because it really dates me, but
Okay.
I started working as an account executive and placing people in jobs.
Okay.
And that's where it started. And
Yeah.
it's that satisfaction, joy you get from like, I found your dream job, or I'm helping you pay your bills, whatever it is. And it's just started there.
So you didn't stay in that, obviously.
No,
You moved to other things.
really what drove
Tell
me
us.
out of that, being an actual frontline recruiter, one of the first outside of the staffing industry, I was recruited into a client. And it was my favorite job, and I tell the story a lot, was recruiting outbound telemarketers. If you want to wean someone out of recruiting, put them in that job, because it's probably the most, it's basically butts and seats, right?
Yeah.
How many people can I get through the door? And so that was short-lived, but it teaches you a lot, again, about, wow, we need some technology here. I can't listen to these,
Right.
this recordings all day, people wanting to get this job. So quickly moved on to being more of a in-house recruiter, and then more around, really helping to, be a manager, motivate the recruiters, be part
Right.
of a team, which, just take that path. And it's not picked. You just kind of go through the motions. You learn what you love. You learn the industries that you love. And I've always said, throughout my entire career, recruiting is recruiting. If you're a great recruiter, if you understand the talent acquisition space, gosh, and I remember my first stint in healthcare when the vernacular changed. You were no longer, it wasn't recruiting, it was talent acquisition. I'm in an
Yes.
elevator with my healthcare badge on, and Carol McDaniel, director, talent acquisition, and patients and other, team members in my organization looking at my name tag and like, so what do you do? Well, do we need to dance for you? Or it's like, it's talent acquisition. It's the more
Yeah.
contemporary version of recruiting.
Yes.
So you could kind of see how that changed, and really, getting people to understand that it wasn't just butts in seats. It's
Right.
really about
Yeah.
building the organization and bringing in the talent that's going to grow your business,
Yeah.
and how
Yeah.
important it is.
So you moved then. How did you enter in Providence?
Well, I've had a very interesting career. I'm a native Floridian, never planned on ever leaving the state. And I got a phone call from Delta Airlines,
Okay.
and was recruited up from healthcare. I was at Johns Hopkins, recruited up to Delta. I had to leave Florida
You didn't
and
go far. Wasn't that just to Atlanta?
to Atlanta, but Atlanta's like, Mars when you're living in Florida. You really don't want to be there. You like,
Okay.
this is not my
Yeah.
not my ideal home, but we made the move, and Delta was an excellent opportunity. And through, due to COVID and some other
Mhm.
crazy
It's a
times,
great company. and
it's an excellent
yeah,
company. It was, supposed to be the end game for me. And obviously COVID had a different intention in
Yeah,
mind. So
right.
we basically all lost our jobs. And so I kind of, was trying to decide what to do. And I had this amazing opportunity to work, got an offer from a startup in New York.
Okay.
Would you be willing to relocate up our offices there in the World Trade Center? It's a food technology company. And I've never worked for a startup before. And I
Right.
thought, the beauty of a startup, and you obviously know this, is the decisions you make literally on the fly. The impact is
It's
immediate.
immediate. Yes.
And it's a huge gratification.
Yeah.
If you have that, that feeling that, immediate gratification, you get it, or it's a disaster immediately.
Right.
And so I loved that thrill. It was just so exciting. So made the move, actually lived in Connecticut, up there for a year, completely restructured the company. All the people team were let go. So back to Atlanta I came. And through networking, I was introduced to my now leader. And Providence is in a very interesting place where they're kind of on the cusp of some really amazing innovation and technology, especially in the recruiting and talent acquisition space. I really didn't want to come back to healthcare. It's a grind. Healthcare's hard.
Healthcare's tough.
Nurses are never going to be fully staffed. We're never going to get past that shortage if you're not innovative in how you utilize your staff and your workforce. You're doomed.
My mother was a nurse and managed a couple of floors.
So you get it.
Nursing,
and it's painful. And literally when your hands are tied, you can't, what can I possibly do? I can't build a nurse. I can't create a nurse. So it's super stressful on a recruiting team, and you never get that gratification of filling a job because you're always behind. So Providence, I don't know if you're aware, we have a BPO in place. So our BPO manages our HR service center, payroll, and talent acquisition.
Okay.
So all core recruiting is outsourced.
Oh.
So I thought it was super interesting. You don't see that in healthcare.
Right.
Very often. So how does that work? And what does the team internally do? And what we've been able to do in the year that I've been there is build this core strategic solutions provider, innovator type of team that I call like our core team. No matter if we brought it all back in and fully staffed a TA function or we stayed in an outsource model, this core team is who we will always need.
So you're not trapped in the day-to-day
I'm
delivery.
not. And our team is not.
Right.
We do, consider ourselves a service delivery organization, and we deliver excellent service. And through our partnership with our BPO, very high level of expectation we have and how they perform. And ultimately, we're all held accountable for it. So there is a vested interest for them to be successful.
Yeah.
But yeah, I don't have that day-to-day. Where's my nurse for the night shift in the ER?
Well, and that's really one of the biggest problems in recruiting departments is that they can't separate the day-to-day from the strategic. They can't get to do the strategic because the day-to-day has such a high workload that you're trapped. You're trapped in a reactionary mode.
That's right.
With every individual recruiter having 30 requisitions open, the manager having to try and swap out recruiters based on capabilities, but not having a system to really do it, not really being able to analyze the data because they don't have time to design the system that will give them the data that they really want.
Exactly.
And so you kind of landed in a nice structure there. That was fortuitous.
Yeah, I think there's challenges in it for sure, but I feel very fortunate that, I can take, 25 years of experience and come in and say, there are some fundamental things we continue to do and elevate from a service perspective. But there's that opportunity to really be innovative and say, we're going to partner differently with the business. We're going to talk about things that the business talks about and the needs. We talk about vacancy rates. We talk about workforce planning. We're strong partners in that area. And when you have leadership that supports that and just, they're not in your business every day. You understand the vision and the mission and the values and you go forward. And it's a really wonderful place to be. I feel very, very fortunate.
Oh, that's great. That's good. That's good. It's nice to be able to, craft a vision and, do the things that shape it. And it's kind of a luxury for, really the experience because a lot of people are not in that situation.
No, and it's not lost on the fact that there are still, healthcare as a whole, as an industry, still there are parts of it that are very, thinking of talent acquisition and frankly, HR as a transaction.
Right.
And so it's building your brand in the organization, which doesn't happen immediately. It's that reinforcement of the data, reinforcement of the why behind what we're doing, why we're changing this workflow, why now we want you to do this, or don't do this anymore because we've got it.
Yeah.
We're going to take care of that. That's the creating a lot of the communications that we do is really teaching and helping the business understand that we're your partner.
Yeah.
We're not the transaction.
Well, so I'm not an expert in healthcare, but one thing I've noticed over the last decade is that because we have healthcare customers, right? So
Here we are.
Yeah, that they have become much more brand focused. 20 years ago, it was just the healthcare institution was the one next to you, and that was yours. And now, you've seen over the years that they have brands based on innovation, based on sometimes in some vertical care capabilities.
Correct.
Right. And I think that the industry has gotten more sophisticated in that way. And it probably has a big impact on recruiting, right? Because, recruiting is always about telling a story, and people respond to stories. If people just respond to compensation, to salary offers, you probably almost, you might not have the right person. But the people that respond to the story and to the idea of what the company is and what it can be and what it means and being part of that, that's kind of like your highest value candidates, right?
You're exactly right. And, it's just as you said, a lot of healthcare organizations now are brand focused. It's a consumer driven market, right? It's patient centric, but it's consumer driven. So recruiting has taken that turn on saying, I'm selling opportunities. And so in order to do that effectively, I have to align with the brand of the organization and tell that story effectively, consistently, and get people to buy in to that brand. You might not be the highest compensation, deliver, into talent. You might be a little below market when it comes to comp. But if you have a great story to tell and you can showcase people in the organization that look and are from, relatable to the potential candidate, you can tell that story and it has impact. And people make a preference, right? People prefer, a certain brand of chips or a certain style of, soft drink, whatever the case may be. Making the case for a preference for Providence will always be our journey.
Right.
And how we tell that story through the many channels, whether it's, through social, whether it's through community activation, whatever it is, we continually push on that story. And that's, I think, the work, as you mentioned earlier, we get to do now. We get to shape and tell the story of our own employees who are, started out. Our own incoming CEO, was hired into the organization as a security officer, and he's the incoming CEO. I mean, his story is quite incredible, but there's hundreds of those in our own organization that, people have come in through, as a housekeeper, cleaning up on the night shift, and now I'm running a scrum team, or I'm a nurse manager, in the NICU. It's incredible.
And a lot of people in healthcare have actually done other jobs and then went back and studied nursing and studied to become a medical technician, and they actually have other journeys that they've experienced. And I'm assuming that they're kind of moving into it. A lot of them are moving into it, having done having other life experiences, and kind of choosing, healthcare. It's a very particular business. You have to really care about people. It's very hard to be in that business if you don't care about people.
If you don't feel grounded in the work and you don't feel you're contributing or you're valuable. I would also say though that it's also kind of a misnomer around healthcare that if you're in data science, you're a systems engineer, there is an incredible career opportunities in what, as you mentioned, healthcare companies are becoming much more innovative.
Yes.
They're looking at AI from a patient, physician perspective.
Get to that. Yeah.
And so, there's incredible opportunities in non-clinical roles that can really, expand your career and your knowledge and your skills. And so that's another part of the story, right?
Yeah.
It's not just when we go to colleges or high schools for that matter, people are like, well, I don't want to be a nurse. I don't want to be a doctor. I don't like blood, whatever it is. But how about data analytics?
Data science.
like data science, epidemiology, where you're focused in on research. There's incredible opportunities, and I think it's just sharing that story at the right level is where we're going to be.
So AI is really rocking the scientific and healthcare communities right now. It's an incredible impact. Are you thinking about AI? How do you think about AI and technology in your group? Because your group's kind of defining the vision for how you provide this service. Okay.
That's a loaded
I know.
question.
Yeah.
I would say, and it's okay on the consumer side, so patient side, physicians, people who are direct patient care. There's tremendous work that's already been done with AI from our leaders who are helping physicians, spend more time by the patient,
Right.
by relieving them of a lot of the tactical day-to-day things that take them away in front of the computer and notes and things of that nature. I would tell you from a talent acquisition strategy perspective, we're approaching it eyes wide open. We are looking at all the ways in which we can enable our BPO partners to utilize AI. We're looking at ways we can enable our strategists within TA to create better experiences for our caregivers, as we call our employees, create better experiences for our hiring managers, and get away from that. I've got to hit 5 buttons to get a rec open. What do I need to do? What can make this easier? So, our toe is in the water. We're looking at our first kind of pass at this is digital assistants.
Right.
So how do we help people along the way? We have to really be careful, but not afraid.
Right.
And that's kind of our balance. We're just being careful to ensure that we're not crossing areas where, we will have a compliance issue. I think it would be the same way within a heavily regulated environment like a Delta Airlines, any airline. You have to really just be sensitive to what you're doing and the preferences that you're making with AI and what you're allowing AI to do for you versus where we need to lean in with a human touch. And I'm a big believer, and the team is very much on board about, tech enabled with a human touch, right?
Yeah.
We really, in healthcare, I find in a lot of the areas that we recruit in, there's still a huge amount of need for that human touch. People still want to talk to someone.
Yes.
But what can we let go of?
Yeah, I always thought it was just how much time I could spend talking to hiring managers, which were my customers, and how much time I could spend talking to the candidates was really the gating factor for how many connections I could establish. Everything else was really just, something you had to do.
That's right.
I went from really zero technology back then, right? Telephone between the two
was
groups
there.
of people.
Yes, I understand.
We really were very bullish on the technology, but never to the sense that it would take away from the human component, just simply to be able to, figure out who the right person was to talk to.
That's right.
Yeah.
And it's interesting because we've, when you talk to, just anyone in the organization and they say, oh, technology, it's replacing humans. We used to be able to pick up the phone and call, our caregiver relations, employee relations, and talk to a human.
You can still pick up the phone.
You can still do that.
Yeah.
But you can also fix your tax withholdings. You can also print your pay slip. You can also, change your address. You don't have to talk to anybody.
Right.
And after, a year or two of that, centralized model through our BPO partnership and through technology, we put things like that in place, and people can't remember, and here's to say you can still talk to somebody, but now you can do things at your convenience in the middle of the night when you wake up at 4 a.m. and go, oh my gosh, I forgot to change my tax withholdings, or my address changed, I got married. And you can do these things at your convenience now. And so people now look back and go, oh yeah, I guess that's right.
Well, I think in recruiting, the big thing for us when we were building, technology, was that we would have conversations with people, but we wanted to have information, and right away the technology was better able to give us the information that we needed. And I think that's not done yet. So I think AI is going to be really good at that.
I agree 100% with you. There's that whole piece, and I don't know if you ever read any articles about recruiter enablement. and giving the recruitment function the tools and the technology they need to have the information and to make, whether it be how you market to a certain population or just having access to all the information you need to make, to tell people what they need to know to make the decision. And that enablement piece is really, really big. It's a little different in our current model, but it's still having those tools and technology at your fingertips as a recruiter to get immediate
because
responses back.
The challenge, is, and I'm sure this is true in healthcare. You have a recruiter who's talking to an oncologist about your oncology program, and in the next minute they're talking to your data scientist candidate about the epidemiology department and what kind of work they're doing. And it's very hard without information. It's very hard to know all those things. You know what I mean?
That's right.
And I think AI is going to offer them the ability to, to understand more quickly what they have to communicate. And obviously they're going to reshape that as they communicate based on how the communication is going. But making information available is, it's hard to beat AI on that.
I agree. Yeah. I'm looking forward to kind of implementing some of those areas where we can really just enable people to be better and more effective at
their jobs because they have more information.
That's right.
I mean, also to be able to identify trends in your organization in terms of how those experiences happen, how the recruiting experience is happening. I always say, if every recruiter was really great at every single thing they recruited for, you'd have a really nice department. It'd be really easy to manage. But that's not the story.
No.
Some people are better at telling a story. Some people are better at dealing with critical issues that candidates have. Some people are better at describing, one area of the business, but they don't really feel confident with describing the other area of the business. And if you look at the patterns of the way you deliver your service, and AI is very good at looking at patterns, as we know,
right?
You might discover that the way you use your own manpower to get the job done needs to be adjusted.
You're exactly right. I mean, putting people where they love what they're doing, they're better at their jobs, and it's great for retention, and it's great for being better brand ambassadors, if you will, for the organization because they're comfortable where they're sitting. Yeah, right. I think there's also and healthcare is no different, that high volume need. There's a place for the story. There's a place for the courting, if you will, and the selling of the opportunities. But there's also, there are people who want to interview Sunday evening and start on Monday, or interview Monday and start on that next Monday. And so, how do you utilize technology and AI to help move people through the process much quicker without missing anything and still giving them a great experience? Because that's where we're leaning into, right? Is that experience of experiencing our brand, experience our mission through the process. Like, how do we do that in a high volume capacity? And then slow it down, pump the brakes, and do it in a very executive recruiting way, or a very valuable nurse that we're trying to bring over from another competing organization. It's so important.
And that's the scaling factor.
Yes.
It has to scale so that it can move up and down in terms of capacity. So it sounds like things are going pretty well, though. So it's
I mean, I think we, Providence as a whole, we have a pretty large footprint on the West Coast. And so we're at about 124,000 employees, 51 hospitals. It's pretty big footprint. But I would tell you that we made 40,000 hires last year. Our vacancy rates are at some of the lowest they've been historically, which is really great. That doesn't mean we don't have huge needs. That doesn't mean we're not always recruiting, but I'm really liking how we're moving the needle, not only with our, your standard numbers, your recruiting metrics, but we're really changing the experience. And that's why I mentioned earlier the focus of this team being kind of solutions providers, innovators, really honing in on that strategy and helping our leaders understand that, based on utilizing what we call our predictive hiring analytics and saying, habitually, this is what we're looking at for you for 2026 or 2025. This is what we want to start doing now, and getting way ahead of, they get nervous. I don't want to open 40 more recs. It's okay. We got you.
Right.
Let's do this and start pipelining and get people through the process. And so that's where I'm really excited. And I think we're really moving the needle there. And so hopefully, like I said, we'll never get over the nursing shortage. It's just going to be our life.
No,
but
that's great.
there's other areas.
Yeah.
Diagnostic imaging. There's a lot of areas where, we don't have enough curriculum. We don't have enough teachers teaching these
things.
And so we're growing our own. We're going to figure this out, and we're putting people through, training classes and certifying them, and trying to build our retention numbers up so we can keep you.
Yeah.
And there's a term out there we've used a couple of times, 6 figures in 6 years. We're going to get you there.
That's a nice story.
Yeah. So we're going to get you there.
If they can learn enough.
Yeah. And how quickly we can do that, because sometimes you can't see past the next month.
Yeah.
If you can see in 3 months, we can get you into a CNA program, and in 6 months, we can get you into nursing school, et cetera.
And the jobs are there.
And the jobs are there.
Jobs are there.
Exactly.
And they're 6-figure jobs. And the value add is really high.
That's right.
In society, so you feel good about that.
That's right.
So yeah, 6 figures in 6 years. That's a nice one. That's got a good.
Yeah. Our CHRO, Greg Till, he talks about that a lot.
Okay.
It's a good little motivator, and people hear that and they're like, wow, can we do that? Yes, you can.
Yeah. Yeah. Well, that's really interesting. It seems like I would be more stressed out if I was recruiting for 50 hospitals than you are. So I'm glad you seem to be.
That's why they
well
have,
adapted
you get
to
your hair
environment.
colored, you get a little, don't look so,
okay.
It's still a heavy job. It's a heavy job, and it's a big responsibility, but I think we've got the right people in the right seats now, and we're moving forward with a really great plan, and I'm just thrilled.
Well, good luck with that. I mean, it's great to. Thank you so much for stopping by.
Thank you for having
some
me.
of that experience. It was an interesting story, and I'd love to, talk to you again.
I would love that.
Okay, fantastic.
Great, thank you.
Thank you.